Broken arm. What should you do? First aid steps everyone should know. What would you do if someone fell, got hit during sports, or was involved in an accident and you suspected they broke their arm? A broken arm can happen in seconds. The important thing is knowing what to do next and what not to do. Today I'm going to walk you through the basic first aid steps for a suspected broken arm, including how to recognize it, how to protect the injury, when to call 911, and some common mistakes you should avoid. Remember, first aid is not about diagnosing the exact type of fracture. Your job is to protect the person from further injury and get them appropriate medical care. Let's get started. What is a broken arm? A broken arm, also called an arm fracture, happens when one or more bones in the arm are cracked or broken. The injury may evolve the upper arm bone and called the humerus, or one of the two bones of the forearm, the radius and ulna. Some fractures are obvious while others aren't. Some might fall and say, I think I sprained it, when they actually have a fracture. That's why you should pay attention to the signs and symptoms and avoid unnecessary moving an injured arm. Signs of a possible broken arm. Some common signs, symptoms include severe or increasing pain, swelling, bruising, tenderness, difficulty moving the arm, wrist, or hand, an unusual bend, angle, or deformity, pain when the person attempts to move the arm, a grinding sensation or sound at the time of injury, numbness or tingling, weakness in the hand or fingers. In a severe fracture, the bone may break through the skin. This is known as an open fracture. If you see a wound around a suspected fracture, bleeding can become another major concern. Don't assume that someone doesn't have a fracture simply because they can still move their fingers or arm. When in doubt, treat the injury seriously and have it medically evaluated. Step 1. Check the scene before helping. Make sure the scene is safe. Ask yourself what caused the injury. Was it a simple fall, or was the person hit by a vehicle, injured by machinery, or involved in another major accident? A serious mechanism of injury could mean there are injuries beyond the arm. If the person is unresponsive, isn't breathing normally, has life threatening bleeding, or appears to have multiple serious injuries, call 911 immediately and prioritize those life threatening conditions. Keep the arm still. One of the most important things you can do for a suspected fracture is prevent unnecessary movement. Encourage the person to keep the injured arm in the position found. Do not try to straighten a badly bent arm. Do not pull on it. Do not attempt to push a bone back underneath the skin. Trying to fix or realign the arm yourself can make the injury worse and may damage blood vessels, nerves, muscles, or other tissues. Your goal is simple: protect the injured arm and minimize movement until professional medical care is available. Control bleeding. If there's bleeding, put on disposable gloves if they're available. Use clean gauze or another clean dressing to help control bleeding. If bone is protruding through the skin, do not push it back inside. Cover the wound with a sterile or clean dressing and seek emergency medical care. Heavy or life-threatening bleeding requires immediate attention. Call 911. Apply a cold pack. For closed injuries, a cold pack may help reduce pain and swelling, but don't put ice directly against bare skin. Wrap the cold pack in a thin towel or cloth and apply it gently to the injured area. Don't press aggressively against the suspected fracture. The ideal is to help manage swelling, not put additional pressure on the injury. Support the arm. If appropriate, the injured arm can sometimes be supported in the position found. A sling may help support an injured arm, but you should avoid unnecessary manipulation to put one on. If you are trained in splinting and a splint is appropriate, immobilize the injury without trying to straighten the arm. When you're not trained or you're unsure what to do, simply keep the person comfortable, preventing unnecessary movement while waiting for professional help may be safer than attempting to complicate splinting. After supporting or splinting an extremity, pay attention to circulation. Watch for increasing numbness, tingling, unusual coldness, or changes in skin color. In the fingers, in the fingers. These can indicate circulation or nerve problems and require prompt medical attention. When should you call 911? Some arm injuries require emergency medical assistance. Call 911 for situations such as severe or uncontrolled bleeding, bone protruding through the skin, an obvious deformed extremity associated with serious injury, loss of feeling or movement. The hand or fingers become unusually pale, blue, or cold. The person becoming unresponsive or having difficulty breathing. Signs of shock, a major fall, vehicle collision, or other serious mechanisms of injury. Any situation where you believe the person's condition could be life-threatening. If you're uncertain about the seriousness of the injury, it's appropriate to seek professional medical advice. What not to do. Let's review some important things you should not do. Don't try to force the arm straight. Don't push exposed bones back into the body. Don't unnecessarily move the injured arm. Don't have the person test it out by repeatedly bending or rotating the arm. Don't place ice directly against the skin. And don't assume everything is okay simply because the person can move their fingers. A fracture needs appropriate medical evaluation. Final review. If you suspect someone has broken their arm, remember these basic priorities. Keep yourself and the injured person safe. Check for life-threatening conditions first. Keep the injured arm as still as reasonably possible and control serious bleeding. Use wrap cold pack for swelling when appropriate. Support the arm without forcing it into a different position and get appropriate medical care. If there are signs of serious emergency, call 911. Knowing the basic first aid can make a big difference when an emergency happens. If this video helped you, make sure to like the video, subscribe to the channel, and share it with someone who needs to know these first aid skills. And if you need CPR, first aid, or AED certifications, visit CPRFirstAidSavers.com or simply call me at 770-670-1956. And I'll see you in the next video.